Thank you for joining us, Larry. Really looking forward to speaking to you. Now, an outbreak of the potentially life-threatening rodent-borne disease on a cruise ship sailing across the South Atlantic carrying 150 people. That's where this outbreak took place. And this is dominating the headlines across the world. 3 people have died, and there are concerns about human-to-human transmission, with possible cases spreading around the world. We know 2 people are isolating here in the UK after leaving the ship, the MV Hondius. World health officials are stressing and continue to stress that there is a low risk to the wider population. But after COVID and the pandemic, zoonotic viruses that jump from animals to humans, are going to cause concern. So Larry and I are here to tackle your questions, and there are excellent questions lined up already, from transmission and symptoms to prevention and global impact, for the next 30 minutes or so. You can scan the QR code on your screen now to submit a question if you haven't done that already, or via our Hantavirus live page, where you will also find minute-by-minute updates on this story. Thanks to the hundreds of you who have sent questions in to us. Let's get to it. We'll start with a question from Bob, who rightly points out that this is not a new virus. Bob says, there are thousands of cases of this virus every year recorded, so why is the spread of this one so special? Larry, why is this particular outbreak of hantavirus so special? Why is it dominating global headlines?
I think there's a few reasons, actually. One is that this is a very rare strain of the hantavirus. Almost all strains are rodent-borne, that is a mouse or a rat, and you're exposed to their droppings or their urine or their saliva, but it's not person-to-person transmissible. It's very rare to have a person-to-person transmissible hantavirus. It only occurs in the Andes, in southern part of South America. But it so happens that this ship set sail from Argentina, and the working theory right now of the World Health Organization is that somebody came on board already infected with it, and then it spread. So I think the first thing that makes this very rare is that this is, a transmissible disease. The second is that it's happening on a cruise ship. And, cruise ships are kind of structurally unique in the risk for transmission of infectious diseases. People are crowded aboard a vessel. They're traveling from port to port. People come on, people go off the port. And so for many of these cruise ships, they're kind of somebody is very fearful that they're going to be stuck on them. And then the final reason, if I may, is I think this is kind of the shades of COVID. I don't know if your viewers will remember the Princess Diamond cruise ship very early in the COVID pandemic off the coast of Japan. Now that COVID was a much more transmissible disease than hantavirus is, but they were not allowed to disembark. Passengers were panicked. When they did disembark, they scattered to 4 corners of the world. That's already happened with this particular outbreak of hantavirus. And so you've got the kind of perfect storm of a virus on a crowded ship where nobody takes responsibility for it, not the ship owners, not the people on the governments on board. And then they scatter everywhere, and you have inconsistent monitoring, surveillance, and treatment. Now, that is a nightmare.
It is the perfect nightmare, because this is a ship which is in the middle of the ocean. There are, sadly, people who are dying, people who are falling very sick. So you don't know about the medical infrastructure on board this ship. People have to be medevaced. There's so much to this particular story. And I'm glad you mentioned the pandemic, because we all thought about that boat, that ship during the pandemic, the COVID pandemic. And here's a question a lot of people are asking, and it's related to what you just said, Larry. Is this likely to start another pandemic or even a wider scale endemic?
No, it's not. Now, I know people have heard this before during COVID, and there's a little bit of distrust in science and public health these days. And of course, things could change. You know, you could get a variant, things could evolve. But from all the evidence that we know, this is not a highly transmissible disease. Just to give you your viewers some context. So let's say you've got 10 people in a room and somebody with measles comes in and they stay there for an hour. When that person leaves, 9 people will have contracted measles. COVID is very contagious. It's airborne, it's aerosolized, as we all know. But this hantavirus, the Andes strain, requires really close, prolonged contact. For example, sharing a cabin among a spouse or family. And so the risk is mostly to those who are in very close contact to people who are already infected. So it's not something that spreads very easily. But, you know, we need to take this seriously because in many ways it's more lethal than COVID. That is, it's more pathogenic, but it doesn't have the capacity to transmit anywhere near SARS-CoV-2 or measles or any number of diseases.
I should have said that question was from Milk. Thank you, Larry. This is another question from Rachel, and it's sort of linked to what you were just talking about, the transmissibility, because she talks about traveling on an aircraft. And there has been some mention of passengers who've been traveling with other potentially infected passengers. So Rachel asks, is the virus more contagious than first thought? Should I wear a mask on a flight via Amsterdam next week?
No, as far as we know, it's not as infectious as people worry about. Some people in the media have overhyped it. This is not going to be a pandemic, and it's not going to be a sustained long outbreak unless things change rapidly. One of the things that I've learned, I'm leading a Nature Medicine Commission on quality health information. And one thing I always say, you know, tell people what you know, tell them what you don't know, tell them what you want to find out, what you don't know. But as far as what we really know, this is not a highly transmissible disease. Should you wear a mask on a long haul flight? Perhaps, but probably not because of hantavirus, but for coronaviruses, influenza viruses, measles viruses, and the like.
That's right, because this is not a virus which stays behind on surfaces. So you can't just sit in a chair where a suspected infected hantavirus carrier was there. Has to be close contact, and it's through the air, and you have to take that virus into your system through your breathing. On symptoms of the virus, Tinker asks, if the incubation period is 8 weeks, are people contagious during this period or only when symptoms present, as it's not clear online? And that might be a dig at us for not making that very clear in our reporting. So the question is, are people contagious when they're during that incubation period or only when their symptoms first present? Good question. Thank you, Tinker.
Yeah, it is a very good question. As far as we know, since this is very, very rare strain of the hantavirus, we know that it's very hard to transmit. As I've mentioned, it needs very close and very prolonged contact. I think we need to assume at this stage that any time that the person is infected but not yet showing symptoms, that they might be contagious. And so we need to take this seriously. I think we need to do some, careful monitoring of all people who are exposed to the disease. Self-isolation which I know that the British health authorities have been recommending to Brits who are home from that ship. I think that's the wise course.
Okay. Sarah asks, and I'm really glad she asked this because I have some information which, Larry, I don't think you have. Is there no treatment for this virus once caught? As the virus has been known for many years, we talked about Hantavirus being around for a long time. Has a treatment not yet been made? Is there a vaccine to prevent transmission? Do you want to talk about treatment, first of all?
Yeah, I mean, there is no specific cure. So, for example, if you think about, even hard to treat diseases like COVID, there's an antiviral called Paxlovid, or for influenza, you've got Tamiflu. So but here there is no specific antiviral that can cure it. But what is important is that people need close monitoring because after you might start to develop symptoms that might just look like cold-like, nothing. But if it becomes settled in the lungs, it can rapidly become a quite dangerous, quite severe, even lethal disease. And you do need intensive medical support. And that's why, for example, the original port for off the coast of West Africa would not take them on board because
That's
they
in Cape
did not
Verde,
have,
yeah.
yeah, Cape Verde
So
didn't
the
have the
passengers
kind
had
of,
to be airlifted to South Africa because they have the healthcare facilities
exactly.
there.
And that's why under the international health regulations of the World Health Organization, if a country doesn't have the capacity, you need to go to the nearest port. And so I
Okay.
was arguing for quite some time that it should go to the nearest port, which is the Canary Islands, and eventually they agreed. Spain agreed to accept them.
Yeah, after some pushback from the Canary Islands authorities. And on the
Yeah.
vaccine, this is breaking news, Larry, just in the last few minutes before we came on air. Researchers at the University of Bath have said a highly promising vaccine for hantavirus is being developed by researchers from the university. This will be a completely new vaccine. It's been tested in both the laboratory and animal models, which have yielded excellent immune responses. The research team expects to proceed to phase 1 human clinical trials in the near future. So that's good news, Larry. What's your response to that?
My response is that it's good news, but it's not, as we say in America, a slam dunk, because sometimes vaccines can be effective in the lab or in laboratory conditions or in animal populations, but not when it comes to clinical trials. And so it's got a way to go with phase 1, phase 2, and then ultimately phase 3 clinical trials. But it's very good to hear.
Yes, good progress. Right, we were talking about the Canary Islands as being the next destination for the MV Hondius. The cruise ship is on its way there now. It started sailing towards the islands off the west coast of Africa, and 3 passengers have been evacuated. Denise wants to know, those 140 or so passengers getting off the ship in Tenerife in the Canary Islands, including Britons, where are they going to go? And are they not a danger of spreading it to the wider public on the Canary Islands? And that's why there's been this pushback from the authorities on the Canary Islands. They don't want the ship there, but the Spanish authorities have overruled and said it must go there because they're respecting international law. Are those passengers, once they disembark, are they a danger to the local population?
One of the things you just said, Ashish, which was really, really good and important, is that Spain does have an obligation under the international health regulations, which govern these kinds of cruise ships. So they really should take them on board. I don't know if your viewers listen to some of the passengers on board and the fear in their voice. You can't just let them sit on board of a contaminated ship and hope, and take no responsibility. So they should be deboarded. But the problem is that they they may very well end up being repatriated to their own home countries. It's not well known, but a couple of dozen of passengers after the first death disembarked in St. Helens and also were repatriated all across the
Mm.
world. And really don't know the level of monitoring, surveillance, self-isolation, and treatment that's available once these people scatter. And so there really needs to be, very careful consideration. Yes, let them go home, but do so under very strict conditions once the risk has left. As I say, the risk is not large. It still is remote. But nonetheless, you need to take these things seriously. Infectious diseases, particularly deadly ones like the hantavirus, need to be taken very seriously.
Larry, you're sitting in your office in Washington, D.C., but you are very, very familiar with Britain. You've lived in London and Oxford for a long time. So, the next few questions, you will understand why people are a little bit more worried. The Canary Islands is a very popular destination for British holidaymakers. We're coming up to the summer months. People are preparing to leave for the Canary Islands. It's like you have the islands in the Caribbean, very short distance away, very popular
Yeah, I
destination.
know it's a very popular holiday
Yeah. So
destination.
Sal wants to know: is it safe to be traveling to the Canary Islands with kids in the next 2 weeks? Are children at a higher risk for catching hantavirus? So, are there cohorts of patients who are at particular risk?
I mean, no, I don't think children, we don't know that children are at greater risk. I mean, anyone who's already got, significant chronic health conditions like pulmonary disease may be more risk, but that's true with kind of any infectious disease, particularly respiratory ones. But, the truth is, I think unless we know further and unless there are some unexpected turns to this, I think individuals are very safe to take their families to the Canary Islands. They can holiday. You don't have to take any special precautions. This is really very difficult to transmit this disease. You need to be very close quarters for prolonged period of time with somebody that's exposed. You're not going to just, walk in your hotel lobby or on the street and get this. I think, people can be reassured that the risk is very, very low, and they'll probably have, just as great a risk of, getting a vaccine preventable disease like measles in their travels. So, no, it's not something that I would stop a holiday for.
Yeah, the next two questions from Kat and Josh, again talking about the dangers of traveling to the Canary Islands, to Tenerife. People are really worried about this, and we talked about this at the beginning of this Q&A, and that's because of all the pandemic triggers. 5 years
Yes,
ago,
I know where you're going with
yeah,
this.
so five
Yes.
years ago, we if somebody had said human to human transmission, wearing protective clothing, incubation periods, we would have
Yeah.
thought, what? Who? We don't know what you're talking about. We don't really care. We're not really
Yeah.
worried. But just 5 years on from the pandemic, you have a potentially deadly virus that is human
Yeah.
to human transmissible. So you can understand why there's so much anxiety.
Totally.
People are talking about canceling their holidays. You're against that. You think it's safe to
I
travel
think
to the
I
Canary
do.
Islands.
I do. The if it's any consolation to viewers, I did. I was a very public figure in the United States and actually globally during COVID. And when I was asked, even very early on in the COVID pandemic, should you travel? My answer was an absolute no. You should not travel. So if I really thought that the hantavirus posed a significant risk to individuals from travel, I would absolutely say so. As I say, you can never know if what we don't know. It's always possible that this is more transmissible than we think, or there's been some kind of genomic variant that makes it
Mm.
more
Hmm.
transmissible. But for everything we know now, what the World Health Organization, what British health authorities are saying, what the CDC is saying, the risk to individuals is very, very low.
Yeah, I suppose people are worried about mutating viruses. Journalists always like to say viruses are mutating, but that's in their nature. They have to keep mutating. And that doesn't necessarily mean that they become more
No,
pathogenic or more dangerous.
no, it doesn't. And in any case, there are some viruses that are kind of, they're mutating all the time, and we worry about them a lot. Coronavirus mutated much more than we actually thought at the beginning. Influenza viruses are constantly swapping genes, and it makes us worried. To our knowledge, we don't have these, you know, dangerous variants with hantavirus. Again, you don't know what you don't know. And so I'm not saying that, we may find things out in the future, but I think it's really unlikely. This disease has been around for a long time. I think we understand it pretty well.
Yeah. Can I ask, if you do come into contact with somebody who has hantavirus, if you present very quickly with symptoms, there's a very good chance that there are therapies and you can be treated. It doesn't necessarily mean you go from contracting virus to intensive care.
Yes, that's right. I mean, you should absolutely be closely medically monitored and be given the level of care that you require at the time. Not everyone's going to go into intensive care. Not everyone's going to get severe disease. But if you do, we know, there've been 3 deaths on board we know of. That's clear that there is some kind of it's a very pathogenic virus, and you need to take it seriously clinically.
Okay. Kat does ask an extra question, which I'm not going to put to you, Larry, because she's asking, would insurance cover a cancellation? I'm not sure if you're familiar with insurance companies and travel insurance companies here in the UK and how they operate under international jurisdiction. But what I would say to Kat is that sounds like a question for our Money blog team, and I would post that to them if I were you, Kat, to get a very detailed
Yeah.
answer on whether
And
insurance.
what I've learned is that different insurers have different policies and you have different levels.
Yeah.
And so, there's some that you can cancel for any reason and some that are very, very strict about it.
Okay, Kat, ask the Money blog team at Sky News. 2 people isolating in the UK, Larry. We've got this question from Little Lexi. How much risk does this pose to the UK, considering there are now 2 people here in the UK who are self-isolating?
Well, I think particularly if they continue to self-isolate, there's no risk to the public until, if they isolate until after the incubation period, then there's zero risk. The only thing I would say is that for people who are self-isolating, you really don't want to be in close quarters with your children or your spouse or other close family members, because they're probably the ones that are most at risk because they're living with you. But even if somebody, were to break the isolation and walk outside, go for a walk and come home, I've tried to emphasize, because we don't want panic, what WHO has emphasized and what British health authorities have emphasized, which is that the risk to the general public is very, very low. And I do worry about infectious disease risks to the public, but not with hantavirus. I might say, if you've got, mice or rats around, use precautions, and don't come into contact with dropping saliva, or their urine. And if you're cleaning up, just be very careful.
Okay, that applies generally to any rodent excretion, doesn't it? Because rodents carry a whole host of bugs. Larry, this might be a good opportunity to talk about the 2 different strains of hantavirus. We have the old world strain, the new world strain. Because when we spoke to you on Sunday, when this news first broke, everyone wanted to know, is human-to-human transmission possible? And everyone said, very, very rare, but there is a caveat. Maybe you'd like to explain that caveat.
Yeah, and I did say the same thing to Sky News when I was interviewed. Most of the hantavirus disease that we know of is, as we've said, rodent-borne. and it's not person-to-person transmissible. And there are basically two main clinical forms. One is pulmonary, that affects your lungs and has flu-like symptoms. Another is a hemorrhagic fever. It can affect your kidneys, causing, a lot of, pain in your stomach, headache, backache, and things like that. Um, the Andes strain is the only strain that have been reported that is person-to-person transmissible. As I've emphasized, it does take prolonged and extensive contact, close contact, but that arises only in the southern part of South America. And it was a surprise to all of us because we assumed that this cruise ship that the passengers contracted the virus, because a rat or a mice got on board, and there were excretions and became exposed. But the working theory now of the World Health Organization is that somebody who was already infected with the Andes strain of the virus came on board and then transmitted it person to person, particularly for those who were shared the same cabin for a long period of time. But we do need to do epidemiology. We need to make sure that there were no exposures to rat droppings. We need to know whether or not people who were exposed were also in contact with other people on the ship and what precautions they made. This is the problem with cruise ships. It's very, very hard to know how carefully they're monitoring.
Mm.
Now, one of the things, for example, they had a death on ship that they assumed were natural causes, the very first death. They never reported it to health authorities, to the World Health
Okay.
Organization.
That was
And
on the 11th of April,
yeah, and you're
10
supposed to,
days after the ship set sail. Yeah.
and the international health regulations do have an algorithm that tells you when you should report. Now, I don't know what due diligence there was on the ship, whether it really, mirrored a natural death, or whether the tentacles should have been up for some kind of an infectious agent. But those are all things we need to understand, and we don't. This is an ongoing
Mm.
scientific investigation that we need to take very seriously because this shows, I think we're not going to get a pandemic of it, but it really demonstrates how vulnerable we are to an infectious disease now. I think was a stress test for global health security, and we failed it badly.
Powerful words. You've answered the question about the rats in the UK. That was asked by somebody calling themselves A. Can it be contracted from rats in the UK? It can't be because this is a particular strain from the Andes, South America, the Andes Mountains, I'm guessing, and
Yeah,
not by rodents in Europe, Asia, or Africa. There is one
correct.
more question. We have time for one more question. And this leans into your expertise with international law. An anonymous person sent this one in. Why do passengers have to be taken off the ship now? Surely it's safer to leave individuals on the ship until the virus incubation period is over. Seems like the process is being rushed. Is it being rushed?
No, I don't think it's being rushed. First of all, just put yourself in the position of those passengers. Imagine you're on board, you're frightened, you're scared, you're crowded together with others with an infectious disease. Let's suppose that infectious disease was a really seriously transmissible disease.
Mm.
You wouldn't want to wait, because it's a death sentence for the passengers. So you want to have them disembark in a port that has strong public health and health system capabilities, and then to make an evaluation. Do they need to be segregated, isolated, or quarantined in the port, or is it safe to repatriate them home? That's something for public health authorities to do. But what the international health regulations require is for uh, a, a port that has strong health system capacities
Hmm.
to bring them off board, to medically evaluate them, to make a public health decision in conjunction with public health authorities and the World Health Organization about whether they need to be isolated or quarantined for the period of incubation, or whether it's safe to send some or all back home under what medical supervision. The problem, that seems like a really rational way to do it. But, what we learned from COVID, what we learned from this case is that we do anything but the rational view.
Larry, that answer brings this session of Q&A to an end. Thank you so much for sharing your incredible expertise with us and answering all of those questions. And thanks to all of you for sending in those questions. The MV Hondius is on its way now to the Canary Islands. It's expected to dock there on Sunday, so that's about 2.5 days away. And this is an ongoing situation. The ordeal for those passengers on board continues. Larry, maybe we can have you back in the next couple of days. I'm sure there are so many unanswered questions that we would still like your expertise on. But for now, thank you very much for joining us. Remember, this story is being covered live on Sky News, on the app and on your television screen. So do follow there.
Thank you for having me. I really enjoyed it.